Hey everybody, it's Jessica DeMassa with WTF Health. What's the future health? I am talking to the who's who of health tech and healthcare innovation. And today we are getting into the DoorDash for lab draws. That is right. We are going to meet Sprinter Health and its CEO, Max Cohen. Max, it's a pleasure to have you here.
Hey Jessica, thanks for having me. It's awesome to be here.
Okay, so I had to invite you on, Max, because when Sprinter Health raised its $33 million Series A in October of 21, led by Andreessen Horowitz, this caused a little bit of controversy between me and the co-host of my other show, Matthew Holt, who just immediately was like, I do not understand this company's business model. I don't know why Andreessen is in it. I don't understand why General Catalyst backed their seed round. I don't understand why the CEO of DoorDash is in this. We need to understand what is going on with Sprinter Health. And so, Max, I had to have you on. I need you to talk to me about Sprinter Health. Talk to me about these in-home lab draws that you guys are doing, the network that you're building there, and what caught the attention of like this really influential group of investors and Andreessen, General Catalyst, Excel, Google Ventures, Bill Frist, and CEO DoorDash.
Yeah, well, it's funny because when the coverage first started coming out, I had a lot of people send various articles to me. The most that I got sent, I think, was Matthew's tweet, where he was questioning our very existence. And
Exactly.
to be fair, it was actually very valid criticism in the sense that healthcare is not designed around convenience. Have been some attempts about that, but that's not really a winning model in the healthcare industry to just say, let's make things easier and damn the cost. That just doesn't work that way. So luckily, our business model is not that, which is just about pure convenience. But in fact, what we're trying to do is we're creating booties on the ground clinicians that can go in the home and treat everyone like a concierge customer, but really gather data in a very affordable way such that their physicians, their providers can treat them in whatever the best possible way is. And so we really think of ourselves as enabling kind of a new form of telehealth. Because if you think about telehealth, it's great for substance abuse. It's great for mental health. It's great for basic primary care if you're not feeling well. But if you need to know what someone's blood pressure is, if you need to have any sort of labs run, you just hit a wall where you have to, the physician has to say, okay, we're going to put in an order. You need to go into our hospital. You need to go into a lab facility. And how many people actually follow up with that? The answer is a lot of people fall off at that point, and so they're not getting really the needed care that they can. And so our job is to try to gather those data points, get it smoothly back to the people who should be making medical decisions, and hopefully make sure that this care is actually completed.
All right, so this is so cool to me. And this is like where I don't know, I got the business model, but it's like you guys are deploying phlebotomists, licensed nurses to do like vital checks, like you said, urinalysis type stuff, blood draws, I mean, even COVID-19 testing at this point.
Mm-hmm.
And I think what's interesting to me is I love how you've connected this now to virtual care delivery. So it's an extension of the telehealth model. So say a little bit more about that in the sense of like, how are you guys, how is service initiated? Is this something where a patient, a consumer is directly calling Sprinter to get this done? Is the telehealth company referring to you? Is the health system sending you out? Like, how does that work?
Yeah, so we've got a bunch of different customer types. So I'll talk about the D2C model, direct to consumer first, because that's
Okay.
the one that I think is the most obvious. If someone does want to just have us come and they have a lab rec in hand, we can do that. So it's a lot of our customers right now. It's funny, I actually think about when I went on road trips as a kid, I would have these invisible ink puzzles, and it would say for ages 8 to 108, or for ages like 5 to 105. Well, we've done ages 3 to 103. So
Okay.
there have been some parents who have special needs kids and they didn't want to take them into a facility, and we've gone in and done those draws for them. We've also done a patient who was 103 years old that was immobile and at home. And so we went in and took care of her needs. And so if people want to book us directly, they can. That's actually a very small part of our business. It's about
Okay.
15 to 20% right now. We are doing a lot in the home health space. And so a lot of home health has moved to value-based care, and value-based care is something that's going to be a little bit of a theme throughout this. Anyone, it's essentially the broader risk models, where they're having huge staffing shortages. They don't have the nursing coverage to be able to go in. And so when they just need some of these basic items collected, whether it's blood, urinalysis, or some vitals, they'll actually have us go in on their behalf and do that. So that's a pretty sizable business, especially in the Bay Area. We've got about 25 to 30 home health partners right now
Okay.
in the Bay Area alone. We're also working on behalf of specialty labs. So some of the cancer screens, we did a press release not too long ago with Naveris, which has this amazing test for head and neck cancer. And so we'll go in, they'll actually fund having us do the draw, make sure that's packaged correctly, go to FedEx and drop it off. And so most of our model is around not charging a patient, but having someone else on the patient's behalf dispatch us to their home.
Okay. And then what stops those somebody else's from just doing this themselves? So like if you're working with a specialty lab, or if you're working with a health system, or you're working with one of these, organizations that deploys you so that the patient doesn't have to pay for it. I mean, what stops them from ultimately, setting up their own mobile phlebotomist type extension to their services? Like, how is your business model defensible?
Yeah, so there's two pieces I think of that are important. One is utilization, which is how many appointments would you be doing a day? And the second one is the contractor versus full-time model. So
Okay.
I'll start with utilization. If you are a health system, you have a lot of patients, but you probably do not have the logistics experience in order to make sure that you're sending the right person to the right place. You have to then hire additional full-time staff to do these kinds of things. And so if you could do 3, 4, 5 appointments a day, your cost per appointment is going to be incredibly high. The benefit of our model is because as Sprinter Health, we're working with everyone. We really intend to partner with as many people as possible, that we can do 8, 10, 12 appointments a day, which is significantly cheaper on a per appointment basis. And so the actual implementation cost, you as a partner don't have to have 12 people in the Menlo Park area that day to make it affordable. We can do 1 or 2 for you because we're doing lots of others for lots of other partners as well. So that's one piece.
Okay.
The other one is generally when people think about this, you can either go the contractor model or you can go the full-time employee model. We've gone the W-2 full-time model. And to be honest, there are pros and cons of that. So with contractors, you can have thousands of skilled clinicians in your network and you can cover all over the country. So if someone says, I need help in 14 different states right now, Sprinter Health is not the best for you because we're not going to be in all of those 14 states. You'd have to have multiple partners. We can help you in some areas that we are currently in, but you'll need to supplement. The issue is that contracting almost counterintuitively is actually more expensive than the full-time model because there's some company that's taking $30 to $50 for the booking and the customer service. And so there's like a chunk being taken out of that from a middleman essentially. So with the full-time model, when you are highly utilized, it's actually significantly cheaper. When you are not utilized, it's more expensive, right? Just in terms of an average per appointment. And so by going the full-time model and aggregating up a bunch of these customers, we're able to offer this service that's significantly cheaper than what it would cost them to do themselves or to use a contractor system.
Okay. And that would apply to I think, of Uber Health, right? Other as soon as you said logistics, immediately I'm thinking okay, who else has a lock on redefining logistics in the healthcare space? Uber Health or Lyft Health. They're in this space. And I know, one differentiator is, that you guys have phlebotomists and licensed nurses on staff here. But is there any concern that they might enter into this space on your behalf?
Man, I love Uber. I don't want my Uber driver drawing my blood. The
Neither
reality
do
is
I.
that the reality is they have done a great job about getting to the doorway and add in more. There's DoorDash, there's Instacart. All these companies have other business lines and they are becoming amazing last mile delivery services. They're certainly going to do a hell of a lot better than we can for many years. The thing is, what happens once you're inside the house? And so one of the products we're building out in the telehealth side is we come with an iPad and a hotspot. And so you have seniors who might not have access to the internet or might not know how to have it work. They might have a home Bluetooth blood pressure cuff, but did they set it up properly? Did they pair it? Do they even know what their router password is? It might be written somewhere down and they don't know where it is. So we're actually bringing the whole telehealth system essentially so that we can complete that. I think that absolutely Uber, Instacart, DoorDash, they have the resources to build this out. Do they want to start having trained clinicians to go into the home and do these? It's a pretty different business when they have enough opportunity in front of it.
Absolutely. Max, tell me a little bit about the patients that you're seeing. Are they mostly seniors or is it pretty much, I know you said from 3 to 103, but can you give us a little bit of a breakdown on who you're servicing most right now?
Yeah, so home health is the plurality of our business right now.
Sure.
There's a few reasons for that. It's you actually have some people who are homebound and cannot actually exit the house, and in other cases, it's you might whoever's responsible for their care. Medical transport could cost you $120 to $150 just to get them to the lab and back. And if there's not medical transport, the onus falls on their adult children and others who have to take care of them. There's caretakers involved. It's just very complex. And so we found a pretty big need for our services to go in and do this real quickly. So that's where the majority of our customers are. The concierge level is actually a pretty small piece of our business. It's something that from a mission perspective, I mean, the thing about healthcare access is we want to help people regardless of economic basis. We're not going to discriminate against people who also want to pay for convenience as well. And so we do have partnerships with some concierge medical places as well, where these are busy professionals. They frankly don't want to miss time from work. And so they'll have us go and do it. That's normally the younger crowd in the 30 to 50 range. And then we've been doing a lot of business in the pediatric side as well. Again, it's just, I've got an 8-year-old. I've had to drag him along to various things for either myself or do it for him. And when you can have someone be at home on their couch and just be a little bit more comfortable, it generally leads to better engagements.
Absolutely. And I'm looking at your service areas. I mean, you're in Sacramento, you're in the Bay Area and Los Angeles. And I lived in Los Angeles for a time. And it's like to drive anywhere. I mean, I'd be one of those convenience people like, yeah, sure, bring it to me. It's actually worth it.
Yeah.
So talk about scaling this out, Max, because I mean, and I'm curious, let's start with the geographical expansion. So you guys, like I said, live in those 3 markets right now.
Yep.
Give us a sense of like, are you sticking around there for a little while as you continue to build out the model, or are plans for growth into new areas just yet? Tell me.
Yeah, so the Bay, I love the Bay Area. I've lived here for 7 years. I was actually in LA before and love LA as well. The reason I left was it took 45 minutes to go to the grocery store or to dinner or to school or anything. So I was like, okay, we need to get away from that. But the Bay Area is a strange market for a lot of reasons. Although you might be able to make money in the Bay Area, I don't actually think you're doing a net national good because other markets are going to be so different. And so we're actually expanding to Georgia in the next couple of weeks. New Jersey is coming up. We're going where our partners need us, to be clear. So we're not just going to set up shop and then say, hey, here's our shingle, come find us. We're working with some of the bigger health systems, we're working with Medicare Advantage plans. And so they have certain needs where they say, we just have lots of options out there and we haven't been able to find something that actually works. Along those lines, there's actually one home health company that previously had been doing all these types of services in-house and hadn't used any partners. And now they're going to start using us because of the type of quality and some of the systems that we have in place. And so we're going to use that to go essentially to Georgia, New Jersey. South Florida is also coming up pretty soon here. And the plan is to add Texas and New York as well over the next 6 months.
Okay. Quick question on Georgia real quick there, and maybe Texas as well. Mostly in metropolitan areas or rural? I mean, all the other places you listed have like very strong metro areas. And
Sure.
I'm curious about like, rural health being what it is, and especially with an aging population that's out there that is, key in your demographic. Designs on rural, or are you sticking around in the Atlanta or like metro areas in Texas?
Yeah, I mean, we start starting in the metro areas because we want to get our base of operations up and running. Rural health is a serious problem that's only going to get worse, and there are no good solutions yet. I will say that our model is asset light, meaning where we hire a sprinter, that is where their service area is. And so you don't need to have someone necessarily drive out an hour to some of the more rural counties. You hire people from those areas who are skilled. They stay close to home. It's still, because it's rural, you're going to have a longer distance time. But one thing we try to do is a lot of the companies out there that are in a similar business to us, you don't know how much you're going to pay when you use them because there's surcharges based on mileage. And we just suck all that up into one fee, and we need the right data to make sure that we do that correctly. But we want to charge you a consistent fee, which covers all of that, just so that you have predictability into what your expenses are going to be at the end of the quarter. And so from that perspective, we need to crack rural. We haven't done it too much yet. We are in the Bay Area. We have started going pretty far northeast, Contra Costa, some other places. So we are moving out. We're looking at kind of on the way towards Tahoe, northeast of Sacramento as well. And so we are going to make that a key thing to solve. But yeah, the metro areas are generally where you start when you go to a new place.
No, it makes sense. I'm curious about the hiring piece of this too. You brought that up, and I was thinking about that, before we spoke. I'm curious about how this goes for you guys. So, I mean, like right now, especially, I mean, with nurses and phlebotomists in such high demand, I mean, I feel
Yeah.
like they're being pulled, and they've got some sweet offers. Like if I read one more article about how much travel nurses are going to get paid, like I might go and
Then
get
you're
a
going
nursing
back to
degree.
school. There you
I
go. Yeah.
seriously. But I mean, like, how do you win out against that? I mean, like, there's so many different formats now for a healthcare professional who's licensed in that way, or who's a phlebotomist to work. I mean, they're in demand in person, situations. They're in demand virtually. They're in demand in these types of remote work situations. So, like, how do you guys win out and continue to hire at a rate that allows you to scale out?
Yeah, so we are hiring pretty quickly. I think we are hiring a couple phlebotomists a week right now, and as we go into these new areas, we expect that to continue. Ultimately, people want to be compensated fairly. They want to feel like they're valued, and they want to work for a company that makes them proud to work for. So we have levers to pull on those. We can compensate them fairly, right? And so whatever the market rates are, we're going to make sure we pay at that market rate. In terms of making them feel valued, that's one of the things about doing the full-time model is that I was talking to a friend the other day who was using one of the contractor companies, and his patients are very sick. And he said, can you ensure that your phlebotomists are all COVID vaccinated? And the company said, no, we actually can't, which is just part of the model of who we bring on. So we're bringing on people that frankly are bought into the vision and want to participate with us. Does that mean that we're going to lose some people that because of all the demand out there? Absolutely. I think the ones who do kind of join us for this journey, they like the idea of the startup. They like the idea of the custom scrubs that we have with their name on it. They like the idea that we recently had a ping pong tournament in our office. And actually the prize for that was you get to be CEO for a week.
Ooh.
I came in second, so I lost my title. The engineer who won that one, he immediately sent around a Google form asking everyone what exotic car they wanted. I then explained that two things. One, he doesn't actually have the password to the bank account. And two, everyone would have to pay taxes if that was actually given. So it never went anywhere, luckily, and then
Well,
the
it
case
would have been
expired.
cool if a sprinter would have rolled up to somebody's house in LA in a Lamborghini to do their blood draw. I'm just saying. Just saying.
Not exactly the vibe we're going for, but we can talk more about that offline. Regardless, so ultimately, it's about, and this sounds like just like a platitude, and all the executives want to say it's about like being a team. I actually do think if you talk to our sprinters, they'll feel that way. We did an escape room up in the Bay Area with all the sprinters. We're going to have local offsites in the way that startups have frankly figured out this is important to do dinners and do that. So when we have our Atlanta team, they'll be able to have an office there. They can congregate together and go do some of these activities. And so we are kind of running the playbook of how to make a good corporate culture, which I think is not standard in healthcare. Certainly there are some out there that do it, but I think it just kind of leads to folks feeling like they are a little bit more part of a team or a family. And then you pair that with frankly good compensation, which you can't get around. And if you do that, then it's a fun place to work.
I like that. And I like the blended model approach here because I think that is very indicative of the time that we're in and also kind of the change in healthcare. And so, Max, I guess to close this out, I would like to hear a little bit about what's next for you guys. And I want to ask this in two separate ways. So, in terms of the way Sprinter is fitting into the extension of telehealth, and with COVID coming to hopefully a close here, we're starting to
Hopefully.
hear a little bit, yeah, but we're starting to hear a little bit more, not criticism, but definitely, some challenges in the world of virtual care and whether or not
Yeah.
virtual care models are sustainable. I mean, I've got my own personal opinions, and a lot of people are on the camp that, okay, so much money has been invested into omni-channel delivery now that there is no going back. Others are like, oh yeah, I know, as soon as things are opened back up, this whole virtual thing will fall by the wayside. The bet is placed on you guys, with virtual really taking hold and being the model of healthcare moving forward, or at least being an option for certain things. How do you see this playing out? I mean, like, what are you anticipating for the next year, 2, 3 years out as you guys continue to scale and continue to position yourselves as that extension of telehealth?
Yeah. Virtual first primary care, if it's virtual only, doesn't make sense to me. I mean, you
Okay.
just cannot truly treat a patient if that's all it is. The other thing that I think about a lot is that the healthcare system over the last 50 years, 100 years has been designed around the convenience of the physician or the healthcare providers. It hasn't been designed around the convenience of the patient. That was okay when everyone didn't have phones in their pocket, didn't have access to information about the world, and didn't have access to the DoorDashes and the Instacarts and all those types of things. Convenience is not something that is a nice to have anymore. It's almost become a necessity with how busy we all are. And so I do think that there is a fundamental shift. You have to have a compelling product that's at a compelling price point, though, to make this work. I mean, the thing that people sometimes say, what keeps you up at night? And we worship at the altar of product market fit in the tech world, as we call it, PMF. And you want to make sure that you have a product that the market wants and that you can offer it at a price that people are willing to pay. If I could offer our service for near $0, there is no question this would be ubiquitous. If this service ended up costing $150 to $200 every time, we're out of business.
Yeah.
And so what is the right part where we are creating enough value on behalf of the provider and the patient and making it affordable enough to actually deliver that service? And so I think that we will be in a sweet spot. Time will tell. We're still early. We've only been around for a year. But I think over the next few years, you'll find that telehealth plus access to the home through Sprinter and services like it will actually create a alternative that gives you, call it 80% of the value of the in-home visit for 50% of the cost of it. And if you can actually do that, there is a lot of room in this $1 trillion healthcare system to make this pervasive.
All right, I'm going to part B this question because that affordability piece is actually the other thing I wanted to ask you about. I mean, like, is there any concern there? I mean, like, I'm in California right now today. Gas prices are over $5 a gallon. I mean, you guys are like, I mean, this is how you guys get to the patients that you need to see. And I think, you know, one of the things I'd love to get your input on, not only just in this microcosm of like, you know, high gas prices here, but, you know, as people are looking at the value of virtual, affordability is always the thing that comes up as one of the benefits. It's much more affordable than an in-person visit. How do you look at this, Max, moving forward to make sure that it stays affordable so that you aren't at that top end of a price point where things become unrealistic for someone to use you? And obviously you can't charge $0, but how do you maintain a plan moving forward as costs are rising, as you know, we're dealing with a lot of uncertainty economically here? I mean, in the short term, I mean, how do you see your strategy unfolding to remain affordable so that really the benefit of virtual care that leans into that can be played out?
Yeah, so the quick answer is you invest heavily in logistics to make sure that you can make this as affordable as possible. A friend of mine who's in the logistics business was talking about how it's a game of picking up pennies and charging a little bit more than your competition and making sure you're spending a few less pennies in what you do. It's funny because we, with a name like Sprinter, which implies speed, what we don't want to do is make people feel rushed in the home. And so we have no metrics around how quickly do you get an appointment done. We're not I mean, we're looking at that to know, but we're not doing any performance metrics. We don't want people to rush in, do a blood draw and leave real quickly, right? I mean, that's not part of a good patient experience. That being said, we do want to make it as quick as possible when they're outside of the home so they don't have to drive as far. If they have to do a drop-off, we've done partnerships with the major labs to streamline that. And that's also a little bit of a differentiator between us and some of the competition, is that my co-founder worked with me at Google, Oculus, and Facebook. We've got an incredibly high-quality engineering team, Googlers, Facebookers, Amazon, Uber, a bunch of other places. And so we are investing heavily to make sure that we minimize the distance needs to be traveled. We assign to the right Sprinter. When you have a lot of coverage of an area, you don't just say, you're going to go here and then here and then here and here and pay $5.50 per gallon for there. You say, okay, you're going to go here, then here, then here. You're going to go here, then here, then here. And so we built this system that says, what are the service needs? What are the equipment needs? We assign the right person at the right licensure level, whether it's phlebotomist or nurse, and we try to minimize the distance traveled. That's how we keep costs down. The second piece of this is that we actually are pricing it sustainably. So you mentioned our venture capital backers. What I love about them is we are heavily aligned in, let's not just go spend that money in the way that frankly Uber has and some other places to make it as cheap as possible. There's no taxi system to put out a business here. This is something where we are trying to prove out a business model, and we want to make sure that this actually works at a price that is sustainable. There's no benefit to saying, we're going to do 100,000 appointments next year, and then in 3 years, we're going to be gone, because it's just so much more expensive to get this working. And so from that perspective, we are trying to make sure that we're using a high cost market like California to justify the business model. And when we go into lower cost metros, it will be easier versus harder.
That's awesome. All right, Max. Well, thank you for sharing that. I mean, I'm really, the true test is going to come when Matthew Holt watches this video. If we've maybe converted him to understanding the business model, we'll have to look for that.
I'm sure I'll get a notification on my Twitter when he says something. So I'll look forward to that.
Apologies in advance. And we admire your bravery for coming on and talking to me in such great detail about everything so that we can hopefully prove the point here. Appreciate it.
Well, thank you so much for having me.
No, it's been a pleasure. I think this is really interesting and definitely very curious about how this is going to work out moving forward. I love the connection into virtual care and telehealth. And so really excited to see how the model takes hold and how you guys grow and expand. So thank you again.
All right. Thank you.
All right, I'm Jessica DeMassa. That was Max Cohen. He is the co-founder and CEO of Sprinter Health. We are trying to put to bed any types of questions that Matthew Holt might have about their business model and others who might be wondering. So thank you so much for joining us. For more interviews with the who's who of health tech as they are changing the way that we do healthcare, head on over to my YouTube channel. It is youtube.com/WTF Health. I'm Jessica DeMassa. Take care. We'll talk to you soon. Bye.